Hi, can you introduce yourself and tell us what you do for a living?
Hi, my name is Carolyn, and I'm a registered nurse. I have a bachelor's degree in nursing, and I've been doing this for about 12 years now.
What are the reasons why you chose to become a nurse?
I knew I wanted to work in healthcare since I was probably in about elementary school, but I didn't actually decide to be a nurse until after I finished college the first time. But after I graduated with my degree in psychology, I chose to go into nursing because there was a high demand for jobs, a lot of flexibility in the career choices as far as the different types of nursing that are available, and also flexibility in the hours worked. So I knew about alternate scheduling, 12-hour shifts, different hours available to work, and those were all good things for me.
So, what would you recommend for someone that's trying to become a nurse and like the process that they would go through in order to do that?
The first thing to start with is to look at the prerequisites that you need to get into nursing school. For most programs, they all require science classes, microbiology, anatomy and physiology, and chemistry. And then they also require some English, math, psychology, human development, and I think also speech. Nursing school is pretty demanding, and also can be hard to get into, so it's really important that you focus on the grades, especially in your science prerequisites, because they know that people who do well in the sciences will eventually do well in nursing. It's a good foundation for your nursing classes.
Okay. Would you recommend, is nursing a associate's degree, a bachelor's, an upper level degree? What kind of degree do you have to be to become a nurse?
So there's 2 levels of nursing to become a registered nurse. You can have an associate's degree or a bachelor's degree. A bachelor's degree is required for advancing in the career process a little bit more. And a lot of employers are looking at bachelor's degree in higher favor, but it's not required yet at this time. Now, one of the nice things about an associate's degree, if that's the route you choose to take, a lot of schools now have an associate's to bachelor's degree program that you can complete later on. It takes about 1 year, and a lot of hospitals offer tuition reimbursement or will pay your total tuition to finish your bachelor's degree later on.
Okay. When you graduated as a nurse, where did you first start working, and how did you transition into the spot you're in now?
So when I first was hired, I got a job working on a med-surg unit at night. It wasn't exactly what I wanted, but it gave me some really good opportunity to learn as a nurse, because nursing school is really just kind of a foundation, and what makes you a good nurse is your experience and your ability to really assess things in a fluid environment. In school, you learn about textbook, and out in the hospital, you learn to see things as a big picture and know things before they ever happen. So you start to see those signs and see the signs of something coming, know what to expect, and that really only comes with experience. So I got my first 2 years in on med-surg, didn't really love it, but I knew I was still really happy to be a nurse. I just knew that I had to find my spot. And an opportunity came up for an operating room training program, and I shadowed for a couple of days, and I said, well, I'm gonna give this a try. So the training program that I did was 6 months long, but was still paid by my employer. It included both classroom and clinical experience. And I just knew from the beginning that it was definitely my place. So I spent my first 5 years in the operating room, just doing as many type of cases as I could, getting exposed to as many surgeries as I could. I just kind of soaked up as much information as I could possibly get.
Do you like, since you said that your med surg experience wasn't, you knew that you didn't want to do that, now that you've become an operating room nurse, do you feel like this is something that you would do forever, or how do you feel about your current position?
So now I feel like I found what I love to do. I also love that I know that I could at some point decide to do something else. So that's one of the best things about nursing, in my opinion, is that if this job at one point gets too like physically intense, or I don't want something that's I have to be standing a lot of hours for, there are other opportunities. I have the opportunity to go back and get my master's degree and become an advanced practice nurse. Also with my employer, I'm able to use tuition reimbursement to go back and get my master's degree. A lot of employers offer that as part of your benefits, which is really great.
Okay, and what do you do, like what about operating room nursing is so desirable to you? Like why is it such a good career choice for nursing?
I like that we work as a team. You get to know the surgeons you work with, and your surgeons count on their nurses that they work with, like they're an essential part of the surgery. Like they can't do what they do without you. So they're really relying on you to know what they need, have everything ready, and together you work together to have great outcomes for the patients.
Okay, is there anything else you want to say about nursing in general, or to someone struggling to find their way and what they want to do? Any advice you have for them?
I think that it's a lot of sacrifice to go through nursing school. I understand it's a lot of work, it's a lot of time, it's a lot of money, but it's worth it. I ended up with a lot of debt after school, but fortunately I have a job that I can pay off my student loans, and I have a career that I love. I get a lot of paid vacation with my job, which is great. I love to travel, so I at this point I get 6 weeks off a year where I can go travel wherever I want. It's just I think it's worth the sacrifice if you're thinking about how hard it's going to be. I won't say it isn't hard, because it is hard, but your hard work will pay off.
And what about being a nurse during this time of a pandemic? Would you say that it's still the best career choice that you could have made in terms of job security and,
Well, working during this time, I won't lie, has been very stressful, but I think it's been stressful for everyone in the world. And what is good about it is that I know that I have a job and that my salary is for sure gonna be there. I didn't have to ever question if I would have a job or not. And so that was very comforting to know that there's always a need for healthcare. You're never gonna be not in demand.
Okay. Well, we're sitting in an operating room right now. Do you want to give them a tour of the OR and like your work environment?
Operating room, obviously with no patient in it right now, but during a surgery, we would set up all of our instruments on here. We set up a sterile field here, and then our patients over here. Anesthesia would be back here. They have a ventilator machine, anesthesia machine, and we have a lot of equipment. Sometimes you'd be surprised that this whole room can be filled with equipment for one surgery. We have these screens up that we can put images of the patient from the microscope, from the x-rays that we're taking during the case, from the navigation that we're using to track inside the actual human body. it's really amazing the technology that we use, and it's constantly being updated. We're constantly bringing in new equipment, updated equipment, and so I always say that I learn something new every day. You never stop learning in the operating room ever, or in nursing ever. It's always something new.
Okay. Well, thank you for taking the time to do this interview, Carolyn. We appreciate it.
You're welcome. Thank you.